Now, despite several states reporting a crisis in vaccination 3.0, several states are facing crippling shortages of vaccine, basically paralyzing them from starting vaccination 3.0 for people between 18 and 44 on May the 1st. One state is shining among all of them, and that is God's own country, Kerala. With negligible wastage, Kerala has set an example for other states to follow. Gopi Krishnan with this detailed report. Long queues, delays and bottlenecks. Months into India's historic vaccination mission, the country is nowhere close to meeting its targets. With state after state reporting shortages running parallel to huge wastages of vaccines. But one state is shining in the crisis. As vaccine shortages derail plans nearly everywhere else, Pinarayi Vijayan's Kerala is standing out for its super efficient use of vaccines. On Tuesday, the Kerala Chief Minister, fresh from a historic election victory that is said to have been possible because of his COVID governance, said that the state has not only ensured zero wastage, but has administered more vaccines than what has been provided. As on Monday, Kerala has received 73,38,860 doses of vaccine. However, the state has successfully administered 74,26,164 people with vaccines. This even as 3,15,580 are still remaining in the state stock. If you're confused about how there could be greater shots administered than vaccine doses received by Kerala, here's the explanation. Vaccines are stored in small glass bottles called vials. Each vial usually contains 10 doses of vaccine. However, manufacturers do include one extra dose, which is usually regarded as a wastage dose. While filling the syringe each time for each patient, it is possible that a small quantity may be wasted. The wastage dose is included to compensate for this loss. According to the Kerala government, the health staff has successfully administered up to 11 doses from most of its vials. This has helped the state vaccinate more people than the actual number of doses provided to the state.
അതീവ ശ്രദ്ധയോടെ വാക്സിൻ വിതരണം ചെയ്യാൻ സാധിച്ചത് ആരോഗ്യ പ്രവർത്തകരുടെ പ്രത്യേകിച്ച് നഴ്സുമാരുടെ മിടുക്കുകൊണ്ടാണ്. ആരോഗ്യ പ്രവർത്തകരെ ഇക്കാര്യത്തിൽ ഹാർദമായി അഭിനന്ദിക്കുന്നു.
The Chief Minister has also lauded his health workers with praise for their effort in leveraging the maximum from vaccine vials at a time when shortage looms large. But there's no time to celebrate the feat. Kerala's health minister says the situation remains alarming. Though the government has placed orders with manufacturers for vaccines, the supply is expected only by the end of this month.
Yeah, the situation is not very good, but we are enthusiastic that we can tackle this problem. Because of our preparedness, we are ready to vaccinate the people. Whenever we got the vaccine from either central government or from the companies, we just start the vaccination speedily.
Kerala was the state, remember, that recorded India's first COVID case in January last year. But it has come a long way. And now armed with a model that squeezes every drop out of limited vaccine consignments, the state is showing the way.
Vaccine shortage and vaccine wastage continues to be two important challenges for the country's fight against this pandemic. Indeed, the stories from Kerala is something that can be replicated across the country to ensure maximum utilization of the vaccine and ensure maximum people are protected from this deadly disease. With camera representing Kurat Shekharan, Gopi Krishnan, Thiruvananthapuram for India Today.
So it's incredible. We've shown you how Kerala has used even more vaccine than it was supplied, thanks to that little bit of reserve dose that's always there in every single vial. But the story is not the same, sadly, in every other state. Vaccine wastage in other places is horrible. Lakshadweep, the vaccine wastage is 9.76%. Tamil Nadu, it is almost as bad, 8.83%. It's the worst of among the big states. Tamil Nadu, 8.83% of vaccine is wasted. Assam is also quite bad, 7.7%. Manipur, also bad, 7.44%. Haryana, 5.72%. Dadra and Nagar Haveli 4.99. Other big states, Punjab and Bihar, almost around 5% wastage of vaccines. And so that's the list that we have here for you. So Tamil Nadu among the worst in the big states category as far as wastage of vaccines is concerned. Now I want to show you two stories from the